Hello everyone, this is I Will Teach You Medicine, and today we are discussing about congenital cataract. Congenital cataract falls under the pediatric cataract. That means under which there are congenital cataract and developmental cataract and traumatic cataract. Congenital cataract is the type of cataract that is present at birth. When the child is born, they come with the cataract. So that's congenital character. And developmental character means the child develops the cataract after he is born. Not he is born with it, but he or she will eventually develop it. And traumatic cataract means any kind of it's a type of a cataract that follows after any traumatic eye injury. All right, so here is a we can see a photo. This eye seems to be normal, but here maybe due to some kind of trauma, this child has a cataract. So these three falls under the pediatric cataract. All right, so in this child also you can see some kind of opacification, white reflex, so white eye reflex. So yeah, that's cataract. So for the definition of the cataract, it is any kind of congenital opacity of the crystalline lens, and I will have to add lens and its capsule. All right, so congenital cataract means any kind of congenital opacity. This is, suppose this is the crystalline lens, and cataract does not means any kind of opacification in its lens, but also its capsule, that is anteriorly or posteriorly capsule. All right, so that is very important point. So, and cloudiness is present in the lens of the eye, that is present at or developed shortly after the birth. That means congenital and developmental. So congenital cataracts are also the most frequent cause of leukocoria, that is white pupil in the children. Yeah, we can see here white pupil here also and here also. So there are other causes of leukocoria, that is white eye pupillary reflex, that we can see in like diseases of the eye, like retinoblastoma and ROP, that is retinopathy of the prematurity. That's another topic, so we will discuss that, but for now just know that. All right, so coming about etiology. What actually causes the congenital cataract? So if the cataract is in the both eye, this is the eye. I'm sorry for my terrible drawing. So if the cataract is present, the opacity or the cloudiness is present at both eye bilaterally, then it can be caused by either idiopathic or hereditary. Idiopathic 60% of the cases, and in 30% it is due to hereditary. And we should not forget the intrauterine infection, that includes any kind of the sexually transmitted infections to the mother, rubella, etc., etc. So intrauterine infections are also responsible for bilateral cataract. And any kind of so any associated with ocular disorders, it is also associated with any kind of other ocular disorders like ROP. All right, so yeah, like that. And then tumor, so cataract is also associated with some kind of tumor and maternal drug ingestion or malnutrition. There are maternal and matter sorry for that maternal factors that are responsible for the cataract. That includes the drug injection and malnutrition, and then intrauterine infection, and other any kind of the problems, health related problems in the mother. And also trauma. Trauma can be caused in both the eye. Traumatic cancer cataract, any kind of RTI, or any kind of chemical injury, or any kind of trauma, that can also lead to bilateral. So, and in the unilateral cases, idiopathic, it is most of the cases is 80% in the unilateral cases, whereas in the bilateral is 60%. And intrauterine infection is the most commonly is, and it is also associated with the ocular disorders and trauma. All right, so that's both bilateral and unilateral cataract share. Okay, so there is no benefit, as the slide suggests, there is no benefit in doing a large number of tests and investigation of all children with cataract. Why? Because it is associated with familial history, any kind of illnesses or drug used during the pregnancy by the mother, and the history should be consulted, pediatric, and any kind of intrauterine infection, like we discussed above, rubella, cytomegalo, syphilis, these are the STIs. And also cataract can be seen as a feature in the syndromes like Down syndromes, Turner syndromes, Stickler syndromes. So remember this name. So how many people are exactly how many people are exactly affected by the cataract? So around every 2000 child, one child is affected with cataract, congenital cataract, congenital cataract. So, and also out of which, so out of the total cases of cataract, one third is suggested with congenital cataract. The other one third is associated with syndrome, and the other one third is isolated case. All right, so this is very important. This is a very important a rule, we can say. One third by congenital, one third are associated with the syndrome, and one third is isolated, familial, associated with the syndrome and isolated. So let's move on. So yeah, right, okay. So I have like mnemonic, I will come back to later. So morphology, cataract, there are morphologies of the cataract. So several region, why the morphology of the cataract needs to be defined. All right, so it can gives us a clue about, sorry about the writing, I forgot to erase it, but it can give a clue to the age of the onset visual prognosis. Okay, it can give the age of onset visual prognosis, and whether the cataract is heritability or not, I mean you will pass it to your other generation or not. And also it gives a clue about the etiologies. All right, so I have so that this morphology includes a punctuate cataract, or that is also known as blue dot cataract, or anterior polar cataract. That are two types. Pyramidal and reduplicated. We'll read about it later. And then it is the posterior polar cataract. Another is embryonal nuclear cataract, coronary cataract, or colaliform or floriform cataract. A little bit of a tongue twister. Another is a zonular or a lamellar cataract, and other is total cataract, that is soft membranous. So in order, if you are reading this for the first time, don't worry with all these names. So I made one funny mnemonic to make you like understand. So mnemonic is Annapurna base camp. Annapurna base camp is ABC, but the C is square. Okay, Annapurna camp ma T answer. T answer means just say Taranath sir, for example. Annapurna base square, Annapurna base camp square ma तारानाथ सर चाहिँ पाजामाज लाएर चाहिँ जानुभयो. सो यु क्यान सी हियर, दिस इज द टी एन्सर, दिस इज द अन्नपूर्ण बेस क्याम्प, अन्न वे टु एबिसी, एन्ड दिस इज द टी एन्सर. सो इट्स लाइक भिजुअल निमोनिक फर यु. ओके, सो अन्नपूर्ण बेस क्याम्प स्क्वायर, ओके, एबिसिसी मा टी एन्सर तारानाथ सर pajamas, PZs, okay, not pajamas, PAZAMAS, but ZAMAS, PAZAMAS, okay. So keep that in mind, it's just a fun way for you to remember. So let's write it down. Annapurna means A, B, C. Annapurna base camp C square means another C, and T answer pajama लगाएर जानुभयो. So A means anterior polar cataract. All right, and this B means blue dot cataract. It is also known as punctuate cataract. And the other includes coronary cataract. We'll read about it later. All right, so another means a coraliform. Coraliform. All right, co wait coraliform cataract. And T answer go. T means total cataract, N means nuclear cataract. It is also embryonal cataract, in the like developmental process of the lens. That's another topic. And other P, we will read that in anatomy. Maybe I will make a video about the anatomy of the capsule, lens. So let's see. And another is posterior polar cataract. Here is anterior polar. So anterior, if there is anterior, then there should be posterior. And then the zonular cataract, that is also known as lamellar cataract. Okay, so here's an figure also. All right, anterior polar, and here is the pyramidal, posterior polar, subcapsular, posterior cortical, coronary, lamellar, nuclear, and all kind of that. Okay, so let's read about the morphology. So number one, that is the capsular cataract. So there are two capsules, all right, we know that, anterior capsule and posterior capsule. So both the places can be affected by cataract. So anterior capsular cataract and the posterior capsular cataract. So anterior capsular cataract are non-axial, stationary, and visually insignificant. So if this is your lens and this is the capsule, so anterior cataract happens, then it is non-axial, it is stationary and visually insignificant. Whereas and the posterior capsular cataract are very rare, okay, and can be associated with persistent hyaloid artery remnants. So this is an MCQ. Persistent hyaloid artery remnants, they persist. Which of the following cataract persists with the persistent hyaloid artery remnants? That is, the answer is posterior capsular cataract. So here's keep your figure, this is the nuclear cataract, here is the opacification, and in the cortical, and here we can see the posterior capsular cataract. Okay, this is just for your remembrance. So in the capsular cataract, opacity is confined to the anterior or the posterior capsule, as this suggests. So we have capsular cataract. So we will now go to the polar cataract. Okay, so in polar cataract opacity occupy the supracapsular cortex. Okay, supracapsular cortex, and the anterior and the posterior pole of the lens, anterior and the posterior pole of the lens को चाहिँ supracapsular cortex मा चाहिँ polar cataract ले चाहिँ occupy गर्छ. Yeah, so here's we can see here, this is the anterior polar cataract. It is a sharply demarcated opacity at the anterior lens capsule, and usually the size of a pin's head, means very small, tiny, pinhead. So that's about that, and it may project forward into anterior chamber like a pyramidal, like pyramid, or subsequently a subcapsular cataract may develop just behind it within the clear zone in between, that is reduplicated cataract. Here the figure it was here. So is the anterior polar, and here pyramidal, and reduplicated can also be formed. So due to the delayed formation of the anterior chamber, why does the anterior polar cataract exactly occurs? That is due to the delayed formation of the anterior chamber, in the development, while in the development the anterior chamber that is developed, delayed during the development of the lens. So this causes anterior polar cataract. So uh, opacities are stationary, means they are stationary and they do not interfere with the vision, so mostly people are not affected by it. So here's another, let's talk about this also. So so what does mean by the anterior polar cataract? This means the opacity in the anterior pole ma cataract opacity, so that is name is self defining itself. So types on the basis of the morphological patterns, like we read just above, a flat white opacity in the center of the anterior capsule. So anterior capsule, in the center there is the flat white opacities, and in if we see it like this, then it is just flat white. And another kind is pyramidal cataract, that means opacity is cone shaped, means like this. How is a cone shaped? Like this. So if this is the capsule, so let's place an cone here. So yeah, this is the pyramidal cataract of the anterior polar cataract. So double cataract means here the doubling नाम में छ, it's in the name. First opacity, it is in the center of the anterior capsule, and second opacity in the lens fiber lying beneath, lying immediately beneath the first opacity. So here what happens is, this is the anterior capsule, here is in the center, first the opacification happens. So and if we see from the lateral side, here and here there is opacity, and this first opacity occurs here, and in the second opacity occurs just in the lens fibers immediately below the first opacity. So this is known as the double cataract, reduplicated cataract, reduplicated, duplicate boy. So and these two opacities are separated by transparent fibers. Thus the opacity which lies in the inner is called the imprint. So the two types of opacities takes place, that is primary and secondary, or first or second. First opacity takes place, and the second in the that occurs in the transparent fibers that occurs beneath the first opacity of the lens fibers, so the so this one, so which is the opacity which lies in the inner, from the फर्स्ट ओपेसिटीबाट भित्र गएर चाहिँ सेकेन्डमा चाहिँ जुन चाहिँ लाइक ट्रान्सपेरेन्ट फाइबर्सहरू छ त्यसलाई चाहिँ हामीले के देखिन्छ भन्दाखेरि चाहिँ इम्प्रिन्ट, छाप बसेको जस्तो देखिन्छ. दे आर सिन लाइक एन इम्प्रिन्ट. सो द्याट्स इट, nothing more about it. This is just good to know information. And how is the mechanism of formation of the anterior polar cataract? So due to the delayed formation of the anterior chamber, like we read here already, and the contact of the capsule with the cornea, usually after the perforation of the ulcer in the ophthalmioneotrum. So it occurs due to the like capsule, cornea, the cornea. Wait, I don't know how to draw it properly. I mean, I suck at drawing. So here's your cornea and here's your lens. All right, so any kind of perforation, here's suppose here ophthalmia neonatrum causes an ulcer, and due to which the contact of lens with the cornea, so this is a normal. So if this patient suffers from just a like schematic diagram for you to understand. So this person suppose suffers from ophthalmia neonatrum, this child. So the lens and the cornea comes in contact, so that will lead to the mechanism. This is the mechanism of formation of the anterior polar cataract. So now let's go about the posterior polar cataract, that is the opacity in the posterior pole. And there are two types, types of the posterior pole cataract, that is the either stationary or progressive. It means it doesn't move or it progresses. Its name has it, everything is in name. So please like use a mind also, like it's a very simple thing. Don't like think this cataract is a very hard topic, because it's not. And okay, so let's get back to the mechanism of the posterior polar cataract. It is due to the presence persistence of the posterior part of the vascular sheet of the lens. The polar cataract in the lens, there is sometimes in the developmental while the we are developing, or our lens is developing, some something like some organs or some arteries or veins, they have to either they have to get they have to some of the arteries, they have to be like closed, like for example patent ductal arteriosus, the any kind of like failure in the uh, failure of the closure of the ductus arteriosus, that will lead to patent ductus arteriosus in the cardiology, like that. The vascular sheath of the lens, the vascular sheath of the lens is also supposed to be it's also supposed to be like closed, after the birth, but it persists, persistence, so that will lead to the posterior polar cataract. So and also it is also associated with many other condition, like persistent hyaloid artery remnants, that is known as Mittendorf dot. Okay, this is the MCQ question, Mittendorf dot. And another is lenticonus, posterior lenticonus, and persistent hypoplastic primary vitreous. So these are the condition in which the posterior polar cataract is also associated with. So now moving on, we are in the first we were in the pole, and then in the first we were in the capsule and then into the pole. Now we are into the nucleus of the lens. So nuclear cataract, it is associated with rubella, maternal infection, that is rubella. And also it is incidence is more, means the pediatric age group are more infected, there is more incidence of the nuclear cataract if the infection is contracted in the uh, second month. As the slide suggests, incidence of the infection is contracted in the second, I think it's trimester. Okay, let's I'm not quite sure about this trimester, I think. a month. Okay, let's find out. Let's Google. I will comment down if there is any kind of mistake. So yeah, let's read month for now. So development of the lens inhibited at very early stages, you know. So why does it occur? Means the development of lens is inhibited at very early stages. So due to the infection, so nuclear cataract occurs. So embryonal nuclear cataract progresses and becomes total cataract, you know, total cataract also. And this is also associated with microphthalmos. Why it is associated with microphthalmos? Because development of the eye lens or eye is like inhibited as a whole. And nystagmus, strabismus, glaucoma, iris hypoplasia, and pigmentary retinopathy. These are all the signs of the like immature developmental anomalies. So yeah, nuclear cataract is mainly due to the developmental defect. So let's read what's written here. Opacities are confined either confined to embryonic or fetal nuclei of the lens, you know, ef. So nuclear cataract are confined to embryonic or fetal nuclei of the lens. So there are two types of nuclear cataract, that is on the basis of the distribution of the opacity. Total nuclear cataract means totally, you know, this is a lens, so it is the opacity is totally covered, you know. And opacity is dense and central. It is centrally and dense, means like it's very like dense, you know. This is the lens and this is the opacity. And this is bilateral on the other eye also as well. All right, and also non-progressive, it is not progressive. And another is pul wait pulverulent. Pulverulent, okay. Total nuclear cataract and pulverulent nuclear cataract. So here the opacity is like fine, you know, fine, but there is opacification though, not like total nuclear cataract. Like it is not dense and central, but it is like opacity is fine, more like dust. So why does it occurs? The mechanism of the nuclear cataract is due to the inhibition of the lens development and an early stage. That is why only embryonic or fetal lens of the lens are affected, you know. So now let's move on to the zonular or lamellar cataract, also known as lamellar. All right, this is pazama ko z. Okay, zonular, that is also known as lamellar cataract. So this is the most important MCQ. It is the commonest development cataract presenting with visual impairment, means the visual impairment that is seen, it is the commonest cataract is the zonular lamellar cataract, you know. And it may be congenital, occurs in the first year of life. So it can be both, either congenital or developmental, you know, or this is suggest developmental. So it is usually bilateral and hereditary. It is AD, you know, autosomal dominant without any ocular anomaly. So if there is any if like there is no any other anomaly also, that it can be occurred by bilaterally and hereditary. And it is associated with condition, you know. This is associated with hypovitaminosis, vitamin D. Hypovitaminosis matlab, like it means less amount of vitamin, which vitamin D. Or due to hypocalcemia, means less calcium, you know, calcium. And maternal malnutrition means this is due to the developmental anomaly. Like if the mother is while she is in the pregnancy and she is suffering from the malnutrition, so the required nutrition that cannot go to the baby, and that will lead to the zonular, or also known as lamellar cataract. All right, so here we can see this is the very like nice figure. So we can see this is the wait a minute, sorry for that. So this is the lens, and we can see here this, yeah, this you as you can see, this is the cataract, this is the opacification. All right, so it consists of concentric, sharply demarcated zones or lamellae. You know, that's a lamellae of the opacity surrounding a core that is clear and enveloped by the clear cortex externally. Yeah, this is just describe this picture. All right, and then maybe a linear opacities like a spokes of the wheel. Yeah, it says spokes of the wheel. Matlab, it's like a wheel and spokes. You know, you have seen those wheels on the like wheels on the bus go round and round. So this is wheel and spokes of the wheels. So it is also these are called as riders. All right, I'm a rider. provider, yeah, these are the riders. So it is written here also, zonal cataract riders, and that extend outward towards the equator. This is the pathognomic feature. Okay, the riders that are the spokes of wheel that are extends outward towards the equator, the equator of the lens. So yeah, that's, and it and here in the zonular or lamellar cataract, the child presents with photophobia here. Why? Because due to the light scattering, and the surgery is required when the visual acuity is less than 6 by 18. This is very important point. A child if presents with photophobia and his or her visual acuity is less than 6 by 18, then the surgery is indicated. And this is the commonest type of most commonest developmental cataract present with visual impairment of 6 by 18. So that's about it. Okay, now let's read what's written in this. So lamellar opacities affect particularly lamella of the lens, both anteriorly or posteriorly, and in some cases it is associated with a radial extension. All right, radial extension, that is known as riders, just discussed above. So what causes the zonal or lamellar cataract? This is due to the autosomal dominant. It is dominant, all right, and it is again associated with vitamin hypovitaminosis of vitamin D, and hypocalcemia, less calcium, and also maternal rubella infection, that is rubella, STI or any kind of infection during the maternal, that can lead to zonal cataract, and especially this in this case maternal rubella infection between the 7th and 8th week of gestation. So that's about the zonal or lamellar cataract. So characteristic feature: typically this cataract occurs in the zone of the fetal nucleus surrounding the embryonic nucleus. Yes, mostly occurs in the fetal nucleus surrounding the embryonic nucleus. And then the main mass of the lens, that is the internal and the external of the zone of the cataract, is the clear. It is clear, all right, and it is usually bilateral and frequently causes the visual defect of more than 6, visual acuity less than 6 by 18, that will lead to surgery. So now let's study about the another type of developmental cataract, that is axial and sutural cataract. So what it says, look, we can just identify here. We can see that opacity is just y shaped, y-shaped. Yeah, so the opacities follows the anterior or the posterior y suture, that follows the y structure or suture. It may occur in isolation or in association with other opacities. Like it can occur like single cases, and also it can occur with other type of opacities. It suggests, this line suggests that. So types on the basis of size and the shape of the individual opacity, it can be either classified, types can be floriform cataract. Opacities are arranged like a petal of flower. So like this, petal of flower. So this is known as the floriform cataract. Okay, and colariform are like the form of the coral. Okay, wait a minute, I have to show you what a coral is. So this is like a coral. I know I'm telling this for you to understand better. So here we can see this is the coralliform cataract. So this is the seen in the type of the coral. So let's get back. Orange in the form of the coral, and in the spear shaped cataract, they are form of the scattered heaps of the shining crystalline needles. So let's see this picture also. So I could not find a exactly a picture of spear shaped cataract, but here's an example. So like any kind, like this type of configuration, suppose this is the lens. Wait, let me draw it nicely. This is the lens, and you will see any kind of opacification that is like spear shaped. All right. So, and also I found a very good picture of the petal, flower like arrangement one. There was one, wait a minute. So here this is like very good picture of floriform cataract, flower petals like. So yeah, so now let's get back. Spear shaped cataract, and another is anterior axial embryonic cataract, that is occurs as a fine dot near the anterior y suture of the fetal nucleus. All right, so these are the type of the like axial and the sutural cataract. So they include floriform, coralliform, spear-shaped, and anterior axial or embryonic cataract. So now let's move on faster. This is the generalized cataract. That on the category is generalized cataract, that is the coronary cataract. So coronary cataract, that is occurs around the puberty, and it is situated in the deeper layers of the cortex and superficial layer of the adolescent nucleus. All right, so deeper layer of the cortex and the superficial layers of the adolescent nucleus. So it is corona or club shaped. All right, so it is due to the corona, okay, especially in this time of pandemic. Just you have to remember that corona or club shaped opacity near the periphery of the lens. Periphery of the lens, what is it like? Sorry, say club shaped, club shaped here. We can see that club shaped, and that is any it occurs and usually hidden by the iris, while axial region and extreme periphery remains like clear. So the work of hiding it by iris is done here. So non-progressive and does not interfere with vision. So coronary cataract, it does not like actually like interfere the vision. So here you can see, and here in the figure it's given more likely nicely. You can like appreciate, like it's like crown. Corona means crown, so it lies in the deeper cortex, in the deeper cortex, and surrounds the nucleus like a crown, like it's a crown of some kind. And it has the opacity, have a regular radial distribution in the periphery of the lens or corona of club opacity, including the central visual axis, and vision is unaffected, same thing. So next is the punctate or blue dot cataract. So we can see here dot 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 dot, but like this is the most common type of cataract, but vision is usually unaffected, is not affected. All right, so punctate or blue dot cataract, it is the commonest type of the congenital cataract, but the vision is not impaired. So it appears as multiple tiny blue dots all over the lens, especially in the cortex by oblique illumination. If you see with the oblique illumination by the slit lamp, you can see that. So bluish color is due to the, like, why does it seems to be blue? So it is like the same answer as why the sky appears blue, or as mahe nila kyu, you must heard of that song, very nice song. So bluish color of the eye is due to the effects of the dispersion of light, in the same way that the sky appears blue, and here the visual acuity is not affected. And let's see what I have written here. Characteristic punctuate opacities are in the form of the round bluish dot situated in the peripheral part of the adolescent nucleus and the deeper layer of the cortex. I have like visualized also as well. And the next is uh, total congenital cataract. That is total congenital cataract, that is caused due to the maternal rubella, that is rubella cataract also. It is caused by German measles, result as the transplacental. It occurs due to the transplacental transmission of the virus, that is also torch syndrome, rubella, T-O-R. R stands for rubella, that is due to the German measles. So it is transplacental transmission of virus of the fetus from the infected mother, usually during the first trimester of the pregnancy. Yes, I was right, first trimester. The slide I have like mentioned above is wrong. Let me just correct that. Wait a minute, where was it? Yeah, I was right, but uh, second month, this is also trimester, I'm sure, like not in the second month. I think wait, it says second month and here it says trimester, right? So it's the same thing. No, wait a second. hmm First trimester, okay, I think that's the month only. I'm sorry, I apologize. So the transmission is usually during the first trimester of the pregnancy, second month, let's say, but I'm still not sure about it, and I will check it. And the first trimester of pregnancy, that may lead to the serious chronic fetal infection and malformations. So note, the risks of the fetus is closely related to the stage of the gestation at the time of the maternal infection. That is 50% of the fetus infection is about 50% during the first time of the 8 weeks, 33% is between the week of 9 and 12, and about 10% is between the week of the 13 and 24. This is all obs gyne things, but also let's study. After the gestational age of 6 weeks, the virus is incapable of the crossing the lens capsule, so that the lens is immune. Oh, okay, so right, okay, after 6 weeks of gestational age, the virus cannot cross the lens, so that the lens is immune. And although the lens opacity, which may be unilateral or bilateral, are usually present at the birth, they may occasionally develop several weeks or even months later, and the virus is capable of persisting within the lens for up to 2 years of after birth. Therefore, the removal of such cataract is usually followed by the severe inflammatory reaction, that is either uveitis or even endophthalmitis. And there are two types of cataract are seen, that is pearly white nuclear cataract or congenital Morganian cataract. Pearly white nuclear cataract means it can involve the nucleus with a dense pearly appearance, pearl, like a pearl it will appear. And another is Morganian cataract, means like the lens matter, it is soft and it is liquefied, that is known as the Morganian cataract. So congenital rubella and can be prevented by a vaccination of the mother. They have this vaccination in the EPI of Nepal as well. So it can be prevented, vaccine preventable, like infectious disease. And the rubella vaccine is toxic to the fetus, therefore it must be administered until 3 months before the pregnancy. So you have to plan it. All right, you will read all this study in pedi and gyne. So like, if you know, good for you, but also like just have a general idea. So what consists of a rubella syndrome? MCQ, it can be asked. Congenital rubella cataract may also occur alone or as a part of the classical rubella syndrome. These include three things: in the eye, in the ear, and in the heart. Okay, rubella syndrome affects eye, ear, and the heart. Eye means congenital cataract, salt and pepper retinopathy, and microphthalmos. Retinopathy, here we can see the salt and like pepper like appearance, that's why it's named as salt and pepper retinopathy. And microphthalmos means like presence of the small like eye. Microphthalmos and congenital cataract as well are already discussing. Another is the ear defect, that is due to the deafness, that is due to the destruction of the organ of the corti. And another is like heart defect, like patent ductal arteriosus, right? I have like given an example of the patent ductal arteriosus, and here it's already in the rubella syndrome. And pulmonary stenosis and the ventricular VSD, ventricular septal defect. So if you have studied anatomy well, you will know all this, like what are these diseases and what do they cause. And let's go to the next topic, that is the congenital membranous cataract. That is membrane, that congenital means from birth, membranous cataract from that affects the membrane. Sometimes there may be occur total or part there may occur total or partial absorption of the congenital cataract, leaving behind a thin membranous cataract. Absorption of the congenital cataract can occur, but it will also leave a thin membranous cataract, and this is associated with the Hallerman Streiff Francois syndrome. Just by heart that Hallerman Streiff Francois syndrome. Yeah. So yeah, I think that's up to now. Like we have discussed about the cataract and its etiology and other different kinds of like features and all mnemonics. So in the next video we will discuss about its signs, symptoms, investigations, and the surgery. Thank you, and please watch the next video in the part 2. This will be the part 1, and yeah, I will put down this in the like ophthalmology series playlist. Please share it with your friends if you found it useful, or you can just like study with it. Like you can just, if you are bored and don't want to study as well, you can just play this video, put your earphones on or whatever, or go to a walk. I hope this will be helpful, and yeah, consider subscribing. Bye bye.